It is a tough topic to talk about, but April is Child Abuse Prevention Month.
And the majority of child abuse cases are preventable if you know what to look for. Barb Cuppett runs the mental health programming at Accurate Home Care. You guys based in Otsego. Thanks for joining us, Barb.
Thank you very much for having me.
Let's talk first of all about the types of abuse, because when you think child abuse, there can be different things going on.
There are very many different things that can happen with abuse. So the three main types of abuse that we want to look for are child physical abuse, child sexual abuse, and psychological maltreatment. There's also neglect, which is a component to look for as well.
Okay. In terms of child physical abuse, what warning signs should people be looking for? Because they aren't necessarily as obvious as you would think.
No, you don't always see the bruise on the child's arm or a mark on their face. So one of the hallmark features to look for with child physical abuse is that the explanation of the injury doesn't match with what the explanation with their story and injury doesn't match with what happened to the child. Another sign to look for is that how they dress may be inappropriate for the weather. For example, I worked with a child that was wearing a turtleneck in the summer, and it was to hide some rope burns that they had received on their neck. And so another sign that you can look for is if a child is really young and is just learning how to crawl or walk, but they may have an injury that they would not have been able to do themselves, such as get a burn, an immersion burn that someone had done to them.
You see behavioral changes too in
You
kids,
do see
right?
behavioral changes. Children, one thing you want to watch for is a change in their demeanor. So in terms of if they might have been engaged with you and warm and inviting, and all of a sudden they might seem very withdrawn, or you can see a child's behavior become very aggressive.
What types of services does Accurate Home Care provide if people have never heard about you before?
Okay, thanks. We are a company that has two major divisions. We have a home health care division and a mental health division. I'm the manager of the mental health services. We currently have child stay treatment services and in-home family therapy services.
So this is obviously, these kind of things, this is tough stuff when you're someone who's an observer and are debating, do I get involved? Do I talk to the child's parents? Do I call police? What advice do you have for parents out there who might see some of these warning signs that you're talking about?
You are correct. It is very, very challenging and very hard to work with. I think as a parent or as a family member, you want to try to ensure that the child is safe and protective, and the reality is that doesn't always occur. So talking with the child, trying to provide comfort for them. I think it's important in our role, not only as a professional, but like I said, as a family member or in some other capacity. I think it's important if you have that suspicion to really involve Child Protective Services and to call them, and whether you do that in a professional role or in a personal role, but
we got to keep the kids safe.
Got to keep the kids safe. And
Barb, thank you so much for coming in, and it's certainly a tough topic to talk about, but an important one.
Thanks, Barb.
Thank
Kim?
you.